Rizwan Ullah is a consultant ecologist at Eastern Institute.
I can see my slides from here. I can shout from here, so I'll leave the mic. Go towards the place. Well, first of all, thank you very much for inviting me. I'm one of the oncologists at the Woodfarm Oncology Center. I'm sure everybody knows about Woodfarm. I used to treat all the cancers in the past, but the specialty is growing so much that now I have restricted myself to head and neck cancer and breast cancer. These are the two specialties I treat. So, I was just talking to a few people around here. I'm sure everybody remembers one person at least, a relative or a friend who was suffering from cancer. Everybody telling my aunt, my father had this. So cancer is becoming very, very common nowadays. 1 in 3 people, the 1 in 3 of us could be affected by cancer now. That's the sort of statistics showing. The number of people living is going longer and longer now because advancement in the science. So good medicines are available to control infections and others. And one of the risk factors for cancer is old age as well. So we are heading towards more people living longer, and so that is going to increase the number of people having cancer. You see, why do people get cancer? That's $1 million question. We haven't explored everything about cancer right now, but we know a little bit. We know that there is something called DNA in each cells, and if the DNA gets affected by some poisonous environment or something, then the wrong signals goes to the cells, and they start dividing uncontrollably. So that's how people get this cancer, tumors. What we can say is, at the moment, only few cancers are curable. So, looking for a cure, we're talking about many, many years to go. We still don't understand the whole thing about cancer yet. The best we can do is try and prevent it and detect early. So these are the two main messages: is prevention and early detection. These are the two ways by which we can reduce the number of people having cancer. Because still, many of our treatment are not very successful in curing cancer. Only few cancers are curable at the moment. If you look at how people live, if we change our lifestyle, 4 in 10 cancers can be prevented. So it's almost like 40% of the cancer we can prevent by just changing our lifestyle. So what are the problems? Smoking, alcohol, diet, and maintaining ideal body weight. These are the things which we can try and change so that we can reduce our chance of having cancer. If we have a cure for cancer, then these things will contribute towards prevention, and that will increase the number of people living longer. So just to concentrate on the main thing, the smoking. 1 in 4 UK cancer deaths are due to smoking. So nearly 25% of the cancer deaths are because of the smoking. So this one single factor is a very, very important thing. If you look at smokers, some people say, my uncle, he smoked all his years, he lived to 90, he didn't have any cancer or anything. So we don't understand why it affects some people who are smokers, and other people who smoke so much don't get cancer. But what we know is half of all the smokers, 50% of them die of cancer. And not only cancer, you've got other problems like heart diseases, peripheral vascular disease. These are the ones which can happen in smoking. And also by quitting smoking, you can't imagine how much money you save as well. If you smoke one pack a day, 20 cigarettes, and if you save that money for 20 years, you would have saved about 40,000 pounds, which is 2,000 pounds a year you can save by stopping smoking. So there is no age to stop smoking. You can stop smoking at any time. But if you stop smoking at the age of 50, your risk is half. And those who started smoking early, if you stop at 30, the risk is almost like non-smokers. So, we can stop smoking at any kind of age and still get benefit of stopping smoking. Okay. So this is something which is related to the South Asian community. So how many people have tried pan? Yes. When I was in India, as a child, every marriages, every wedding you go, will have a stall, pan stall. And we were not aware of it at the time. And we used to be encouraged to have pan at the time. I'm sure many of you recollect the childhood days. But fortunately, it's becoming less and less now. One of the problems I treat is head and neck cancer. And that's the most common cancer in the South Asian region, especially India, Pakistan. The reason is this smokeless tobacco, the pan. Pan is a beetle quid. It's got all this irritating factor, the lime, the nuts, the leaf, pan leaf itself, and that's kept in the mouth and it irritates the tongue, irritates the floor of the mouth, and what it does is gradually you get tongue cancer, mouth cancer, throat cancer. So I would strongly discourage having any sort of pan, and especially people who are taking it on a continuous basis, because of the irritation it can cause. And this is one of my patients having a tongue cancer. Next one, please. So we talk about prevention of the cancer. Now, the other way of improving the outcomes from people suffering from cancer, spot it early. Some cancers you don't realize, and it strikes somewhere else, and that's too late. But there are some signs you can look for. These signs are quite difficult because they mimic some of the benign conditions as well. But still, some of the things you can do is attend screening. If you get something in the post inviting you to attend some screening program, please do go for it. You've got 3 screening programs in UK. One is bowel screening, breast screening, and cervical screening. Every 3 years, people are asked to come for breast screening. Bowel screening, they look at any blood in the stools, and cervical smears. So, not missing these appointments. It's only done once every 3 years. So if you miss an appointment, you may not be able to detect things early. If you find early, it's very easy to cure these cancers. So, the important message is, please don't ignore when they call you for screening. And how can we detect cancer early so that if we catch it early, we can get rid of it? If you're getting some blood from black passage, or you're coughing of blood or vomiting blood without any obvious injuries, that's one of the signs you have to look for. The other one is if you develop any sort of unexplained lump and it's especially growing, GP. if you're having unexplained weight loss or some sort of pain, people do get pain, the arthritis and problems, but if the pain is just getting worse and doesn't go away, then these are the 4 things to look for. These are the 4 key signs of cancer. So these are the 4 things which mimics other benign problems as well. And this may not be anything serious, but it is advisable to see a GP if you have any one of this. And there are other things to look for as well. Like if somebody's got cough for 3 or more weeks, people get cough or chest infection, you have antibiotic, or it just goes away by itself if it's a viral infection. But if it keeps going on 3 weeks, 4 weeks, especially in smokers, have a checkup. If you find any ulcers in the mouth or tongue region, sore throat, which is not going away, you suffered it for more than 3 weeks, go and see a GP. If you're having difficulty in swallowing, if something is sticking in your chest, it's not going down, or having to go to the toilet quite often, it may be something to do with the prostate cancer. If you have a mole and that mole is changing its shape and color and starts growing, have a checkup. It could be a melanoma. And for women, breast examination, if there's any changes in the nipple or the skin of the breast or shape of the breast or found some lump in the breast, straight away go and see a GP. And they will refer you to the hospital for investigations. Nowadays, if there's anything suspicious, we are bound to see that within 2 weeks. 2 weeks rule is there. So everybody will be seen within 2 weeks if there's any suspicion of cancer. So things move on very fast with NHS now if there is any suspicion of cancer. So this is my last slide, and I'd like to end with a positive note about where we were and where we are now. 1970s compared to 2010. Now twice as many people are surviving cancer for at least 10 years. It's a long time. We're making very slow progress. And there is the reason being, be able to spot cancer early. We've got some better drugs, better than chemotherapy, which can target the cancer without causing too much side effects. And radiotherapy, which technology has improved with radiotherapy, especially with the invention of computers and things. So all these things are making a lot of change to the outcome, but still we are far away from getting a cure for cancer. And 2 main things is prevention and early detection. These are the 2 things which can make a big difference right now. Thank you very much.
Thank you for that narration.